All right, it is 1:30. We've got all of our panelists here at on the TJC side, and so we're going to get started. Thanks everyone for chiming in the chat. Love seeing what organizations and what regions you're all coming from. We're going to have a very robust discussion today, and we are very excited to bring you all along on this conversation. So today we'll be talking about TJC's County Health Equity Dashboard. This is a fairly new innovation that we've brought to the organization, and we'll be talking about new data that's come out for the year 2025. So, just a little housekeeping. This is going to be a recorded webinar. We'll share a lot of information, so don't feel the need to catch it all immediately. We will be emailing the recording and the slides to all of you who registered. So if you don't catch something, don't worry, you'll have this in your inbox in the next couple of days. I'll spend a lot of time today talking about data, the data dashboard, and advocacy from the perspective of TJC. And then we'll have time for Q&A. You might have a lot of thoughts about the information that we share, so I'm excited to hear from you all. There is a Q&A feature on Zoom. You can put your questions in there, and then we'll get to them in turn at the Q&A section. Like I said, we have our comms team monitoring the chat. So if you drop your questions there, we will just migrate it over to the Q&A. But please use the Q&A feature so that we can track everyone's thoughts and questions later on. Folks are jumping in, introducing themselves with their name, organization, and county, and we hope to see those rolling in as more and more people join. So I'm really excited to be presenting this data dashboard release alongside some TJCers. So I'll start introducing myself, and then I'll give them both a chance to introduce themselves. My name is Jane Dimwobi. I'm an attorney here at Tennessee Justice Center. I joined TJC as an Equal Justice Works legal fellow after I graduated from Vanderbilt Law School in 2023. So over the past 2 years, I have been here at TJC working on Medicaid, SNAP, and some of the other public benefits programs. And my goal is to make these programs more accessible for all by providing legal services. And as part of that, I have taken a lot of time to investigate health equity in Tennessee, and that has brought me to data, the question of data, whether it's available, whether it's accessible, and of course, bringing that out to the public as part of our advocacy goal. So I'll be talking to you all about the why behind the data dashboard and what you all can do with it. Also presenting today, I'll have Abigail Mann and Gabrielle Bowie. Abigail and Gabrielle were interns at TJC this summer, and they worked very closely with me to launch the data dashboard, this new version of the data dashboard. So everything you see would not have happened without them. So in a short 2-month internship, they made a huge impact on TJC, and I would just love to give them credit for that. And you'll be hearing from them shortly. So just a little bit of a background on Tennessee Justice Center. TJC is a nonprofit law and advocacy organization, and our mission is to use the law to advance economic, racial, and social justice. And we do that by focusing on the public benefit system, which is a huge, huge foundation for Tennesseans who are seeking better lives and who are working towards their own well-being and that of their neighbors. Our primary focus is healthcare and nutrition, and we work on the TennCare program, as well as SNAP, WIC, TANF, school meals, and more. So our mission is to fight for children, is to fight for older adults, to fight for individuals with disabilities, as well as all Tennesseans who are seeking health equity. How do we do that? Well, a huge bulk of our work is direct representation. So we work with individuals who are on these programs that I just mentioned. They come into our office and they ask us to help them get access to care. And we do that through individual casework. When we identify systemic issues across the healthcare and nutrition spaces, we engage in policy and advocacy. So that's grassroots outreach, that's meeting with legislators and doing what we can to make systemic changes. And we also push for litigation. These class action lawsuits are seeking to improve how the program functions for all using the law as it was designed. So we really do a lot at TJC, and with our various tracks, we're able to achieve our mission. And we couldn't do it all without information. We couldn't do it all without data, which brings me to the topic of today's conversation. We're here today to talk about the data dashboard. If you're new to TJC, you might not have heard about the data dashboard, but this is actually not the first time we've brought it up. So, like I said, when I joined TJC, it was to work on data, to work on policy and research. And I created the data dashboard last year, and the first version launched in October of 2024. So, taking all of the lessons we learned from that initial version, we are re-releasing the dashboard with new data, with updated information, so that folks who have been relying on it can have what they need most to answer their questions. But why? Why data and why the data dashboard? Well, simply put, at TJC, what we believe is what gets measured gets managed. Like I said before, our goal is to make sure that all Tennesseans have access to healthcare and to nutrition. We want folks to have what they need to live healthy and fruitful lives. And in order to do that, we need to essentially give folks the resources they need to survive. And we can't do that. We can't make sure that these programs are working as intended if we don't have data. So data is a great way to get new information about the issues that we should be focusing on. Data is a great way to deepen our understanding of what we already know. So when a client comes into the office and says, "Hey, I'm having this trouble with 10 care," and we already know that's an issue, we can use data to get more context and again deepen our understanding. We know a lot of data is being collected day to day through these programs because they are robust federal programs, so there are a lot of reporting requirements. So we use data we know the data is collected, we want to make sure it has a purpose and an application. So we're just using what's already there. And then finally, when we're looking at data, it can actually reveal data gaps. So things that aren't being collected or things that are being collected but are not being reported. So we can kind of learn new things with any kind of data review and data analysis. And all of that is because we're moving towards health equity for all Tennesseans using this information. So that is why the dashboard exists. That's why we brought it to you all last year and why we're updating this year. And we're so excited to bring that information forward. Because the central question is, how can we eliminate health disparities if we don't know what they are and why and where they exist? And the answer is we can't. We need information. We need location-specific information for our advocacy because we want to make sure that if we identify that there are health disparities in this county or between these regions, we want to make sure that we have the correct information and the timely information to actually address those problems. So this conversation is going to be moving a little bit past the why of the dashboard because again, we've already put it out there, we've already established our mission, and focusing a lot on what you can expect and how you can use the dashboard this year. So the structure of today's conversation will be you'll hear from me about where the dashboard lives on the website and how to navigate to it. It's a bit of a tutorial, a how-to. And then we'll have all the folks you see on here from the TJC side work with me in real time to problem solve things that they are curious about when it comes to health in Tennessee and questions they have that they see in their work that data can actually help them solve. So we'll have an opportunity to see this dashboard in action, which I'm really excited about. And then, of course, I hope that through the Q&A, we'll get a chance to hear from you all about your counties and questions you might have once you see what we've got going on here. So with that, I'm going to move us to the dashboard and switch my screens. Just give me a second here. We are back. So sorry, bear with me for 1 second. So the dashboard, like I said, lives on the TJC website. So what you'll do is type in tnjustice.org. That's our trusty URL. On the website, the dashboard is, of course, an educational resource. So you can actually go to our resources section. And it should be the first thing you see. So you can view the dashboard. and that's going to take you to the page, and all the information is right there. Because the dashboard is the bulk and the crux of TJC's health equity mission, what's also really interesting is you can go to the Our Work page and to the health equity page, and that will actually take you to the dashboard as well. We have a brief mission statement around the dashboard that really just replicates what I've shared with you all, but I'm going to move us to a live tutorial of the data dashboard. So the focus of this dashboard is county level information. These Tennessee's 95 counties all tell a different story. So we wanted to make sure that when we were providing data around health, nutrition, inequity, disparities, that we didn't bulk all of Tennessee into one picture. We wanted to make sure that we broke down all of the information on a county by county basis, because what you experience when it comes to healthcare access or grocery store access in East Tennessee will look very different from Middle Tennessee and from West Tennessee. So that county level focus gives you a high level of specificity that we hope will serve you all in your work. So just to start, this is what the dashboard looks like. We have 7 maps this year, each of them focusing on something different. We've got a demographics and public benefits map, which is just the basics. We work on public benefits programs, so we are putting that information out there. We think it's important for you all to know about population, to know about race and ethnicity in certain counties, and that is just the 101 of TJC's work. It's essentially a background. And then we get into economic stability, because that's really at the core of a lot of what we're talking about today is, do folks have the money they need to live stable lives? And the economic stability map, which I'll show you in a second, is going to dig into income, poverty rates, and housing stability and things of that nature. We'll have a nutrition map, which is focused on all things food access, which again is a huge part of TJC's mission. We'll then move into a health disparities map, which is kind of the catch-all, which will show you where, how equity, what areas have disparities and what equity work remains to be done. And then similarly, we'll have health outcomes. So health disparities shows you how different communities are experiencing the same phenomena differently. But the health outcomes will show you the overall mortality rate, or for example, for a county. We'll talk about maternal health, which is a huge conversation here in Tennessee, which unfortunately has one of the worst maternal health outcomes in the country. With the maternal health map, you'll see a lot around how folks who are pregnant have to navigate the state's somewhat lackluster resources and hopefully again move us towards action. And then finally, we have a behavioral health map. Behavioral health is encompassing both mental health and substance use. So we have information around everything to do with access to mental health providers, youth access to mental care, and substance use disorder, overdose rates, things of that nature. So we try to cover a lot. We try to make sure that folks who are in the broader health justice movement can use this dashboard as a starting point, as a launch pad to future information. And so we touched on quite a few things, which without further ado, I will get into. So like I said, there are 7 maps. The maps are meant to be very straightforward. So you have a brief description. We're not trying to hide the ball, exactly what you can expect to see. On this map, you'll see life expectancy, you'll see medical debt, you'll see healthcare providers, and more. You can easily navigate to each different map, one by one, all laid out very neatly for you all. When you're looking at a map, there's one primary data point that is shared. Here, it's quality of life. And so you can actually navigate if you're what counties have the worst quality of life, and then kind of see which counties have the best quality of life. The map itself is interactive, so you can hover over different counties if you're curious about information across, or you can just focus on one and just scroll through. We wanted to make this as easy to use as possible. So you can literally copy and paste the information that's in the dashboard and paste it in an email, paste it in a Word document, paste it wherever you want and share the information out there. So you can navigate this as easily as you could any other web page. Just right click, copy, paste. Next, the story. This is what I'm really excited about. Last year, we had a dashboard full of lots of numbers, and numbers are great. I'm a numbers person. Not everyone is a numbers person. Actually, react if you consider yourself a numbers person, because I feel like we get 50-50 on these calls. So thumbs up if you consider yourself a data or a numbers person. I'm just curious. Okay, I'm seeing a lot of action, so maybe you'll like this. Last year, we had a dashboard that was full of numbers. We were showing percentages and rates and all of that. And we're really excited about that. But one thing we missed was stories. One thing we prioritized at TJC is stories. So we're really excited to merge those two interests and bring a story that reflects the mission, the issues of the dashboard to you all. So after you look at Williamson County and Maury County and Hardin County, you can actually read a story from a real person, a real TJC client, or a person who we've met at an event who has shared their story with us about this issue. So that balance, I think, is really critical as we try to merge data and storytelling. Finally, there are a bunch of interface options here. You can share the dashboard on Facebook, on LinkedIn, on X, formerly Twitter. You can zoom in, you can zoom out. And of course, we just have some brief notes, brief instructions for you all. Hover over the counties to view the data, zoom in to view the county names. And sometimes we don't have data for every county because that's just the case. There are just sometimes that the data quality isn't high enough, so we just can't report it. That's fine. You'll just see an NA, and that's just a signal to you that for that particular data point, we just don't have the information right now. And once we do, we will update the dashboard accordingly. What I really love is you can get the data. We're not trying to make this difficult to access. If you click this button, it will download the data behind the backend data in an Excel sheet, and then you can use that for your own purposes. So if you didn't want to interact with this through a map form, you know how to use an Excel sheet, you know how to work through it, feel free to do that. You can actually click this button and download the Excel sheet for yourself. If you ever have any questions, you can just reach out to us, of course, but we want to make it so that if you all see a use to this, you can take it and run with it. Finally, you can download the image. If you just want this as a picture of quality of life, best to worst in the state of Tennessee, you can just download that picture and move on with your day. You don't have to use it as an interactive map. So there are just a lot of ways that you can make use of this. And again, it's just like hosted on our website. So those are the basics. Again, our hope is that this is easy to use, this is easy to navigate, and this is something that you all can appreciate. So I'm going to take just a couple of minutes before we turn it over to the conversations just to talk about the different maps. So with the demographics and public benefits map, what we're talking about is enrollment in the program. So you'll just look through and see the number of people who are in each of the programs that we work on. And then you'll also get a chance to see the demographics of that county. So in this case, I can actually just scroll and just see that change as I move across different counties. And then just going down that road, same thing with economic stability. The median household income is there's a huge variety here in Tennessee, with the lowest county being, it's between Grundy and Haywood, and Hancock and Lake. And then the county with the highest median income is Williamson. So just right off the bat, you can get one piece of information. If that's all you get, great. Going down the line to nutrition, we chose to focus on food insecurity rate because it's just a very clear picture of how people access food, whether they struggle to access food or not. And once again, we see a trend. The county with the lowest food insecurity rate is Williamson County. And then as you go, you can kind of see which counties have higher and higher and higher food insecurity rates. And if you want to look at what's going on in a county with a high food insecurity rate, just click in and then you'll see how many grocery stores there are, how many SNAP households there are, and so on and so forth. And I won't spend too much time on some of the other maps because we'll have some of the other panelists chat about those, but just want to focus on the maternal health map because this is always one of the most impactful, which is trying to show you the distance to maternity care for pregnant people in Tennessee. So we have some counties where It's not very far. It's about 3 to 8 miles, but then you have others that are very far, which is closer to 60 miles. So there's a huge range here, and that's true of all the issues we talk about today. And I'm really excited to dig into them. So without further ado, I'm going to welcome Abigail. Abigail, like I said, is one of our interns, and she is a genius behind a lot of this. And so I'm excited to talk with her about some of the work that she did and then some questions we can answer.
Hello, everyone. My name is Abigail Mann. I'm a junior at the University of Southern California. I was a summer intern at TJC this summer, where I helped build the dashboard and prepare it for today's release. Um, and in order to do this, I reviewed last year's dashboard, brainstormed how to improve it, and what new data should be included. And after that, I researched countless data sources related to health quality, health equity, and the overall wellness of Tennesseans across the state. The information I found was very enlightening, especially how access to quality healthcare and nutritious foods impacts the overall quality of life and health for Tennesseans. Today, I'll be talking about two issues that I researched heavily, which are health outcomes and economic stability. As Jane mentioned, the data points on the health outcomes maps are quality of life rank, overdose death rate, obesity, diabetes, cancer incidence and cancer mortality rates, and life expectancy. Meanwhile, the data points on the economic stability map are medium household income, household poverty rate, unemployment, severe housing problems, eviction filing rates, and cost of living. We picked these data points because they show the most important factors to consider when looking at a county. I'm most passionate about the quality of life rank and the median household income and how they relate to each other. The quality of life rank takes into account several factors relating to health, comfort, social belonging, safety, and security. The dashboard highlights how quality of life in different counties compares to one another and puts a ranking so that number one is the best quality of life and number 95 is the worst quality of life. I'm also passionate about the medium household income, and I noticed in the data that the counties with the higher medium household incomes and lower rates of household poverty tend to have a higher quality of life rank. So, if you look at the dashboard, you can see that Williamson County has the number one quality of life rank, as well as the number one highest household income and lowest rate of households in poverty. Whereas Haywood County is number 95 in the medium in the in the quality of life rank and one of the lowest in median household income. And this shows how being able to afford basic necessities such as quality healthcare and having less economic stress can impact health, well-being, and happiness. So my question is there anything I can learn about a county's economic well-being and its overall life expectancy, or what kind of illnesses are prevalent? For example, cancer is often a terminal diagnosis that takes people out of the workforce, putting them at risk of medical debt, which can lead to poverty. Even when cancer isn't terminal, it's debilitating, and often folks are unable to work while receiving treatment, and their capacity to work is reduced while they're in remission.
Yeah, that's a great start. Sorry, y'all, I'm having some screen sharing technical difficulties. That's a great start. So I think what this is a really interesting question because when we see these links between economic stability and quality of life, it can make us think about, the old adage, correlation does not prove causation, but it is still important to connect the dots. So let's start with economic stability, like Abigail was referring to. So here we've got Williamson County, which is by far the highest income county in Tennessee. And then we've got Wilson and Sumner and some others close by. So if we're looking at the median household income and the cost of living, unemployment rate, and things of that nature, eviction filing rate, and we go over to health outcomes, we see that these are the highest ranked counties in the state, and they have the highest life expectancy. So that's a clue right there. So folks, the areas that have the highest median income, not only do they have a higher quality of life overall compared to other counties in the state, they also have the highest life expectancy. And this is really, really, really interesting. And then we can also look at the cancer mortality. So this is a good point. We can look at the total number of cancer deaths in, for example, Davidson County, which is pretty high, but that's just because of population. The cancer rate in Davidson County, the mortality rate, so the rate of people who are dying every year from cancer is around 162. And then if we look at Williamson, it's 121. Let's go back to Haywood that Abigail mentioned, and we see there 187. There are a lot of confounding factors that can lead to this higher cancer mortality rate for a county like Haywood that just has less resources in general. But I think one thing that we can identify for sure is folks with less income, folks with less income that don't have the resources to maybe afford better healthcare, maybe they have less hospitals, and so on, are just in a position to have worse health outcomes. So I think the cancer incidence example is one that we wanted to highlight because you can really, when it's not terminal, is a chronic illness and it's something that you need to manage over the course of your life. So the quality of healthcare that you have is really, really critical. Um, and then, of course, you can read a story that kind of touches on those points. Thank you, Abigail, for focusing on a specific issue like cancer, as well as the link between economic stability and health outcomes. I'm going to turn it over to Gabrielle to introduce herself and talk us through another question that she has.
Hello, everyone. My name is Gabrielle Bowie, and I am a third-year student at the University of Michigan, Ann Arbor. And I was also a summer intern along with Abigail at the Tennessee Justice Center, where we helped build the dashboard and prepare for today's release for you all. Throughout the summer, my task included collecting, cleaning, and updating data for this year's dashboard. I sorted through numerous websites that has so many different data points and so many different references that we could build off of. And one task I had in particular was sorting stories that are correlated with different topics that are covered within the dashboard. For example, stories that mentioned WIC or prenatal care would fall under the maternal health feature. And being able to read each story and look deeply into the experiences of others helped me personify the numbers that we looked at every day. It highlights the faces and the families that would be impacted by disruptions in public benefits, reminding us of the real people behind the issues. And I'm proud to say that you can find a few of these stories directly in our dashboard. And today I'll be talking about two issues I research heavily: maternal health and health disparities. As Jane mentioned, the data points on the maternal health map are low birth weight, infant mortality, maternal vulnerability index, distance to maternity care, chronic health burden, and preterm birth weight. Meanwhile, the data points on the health disparities map are teen care enrollment, life expectancy, healthcare safety nets, uninsured population, medical debt, and health resource shortage areas. I am most passionate about the distance to maternity care that expectant mothers face every day and the amount of healthcare resource shortages there are in a given area. For example, Clay County, the average distance to maternity care is around 64 miles. And as we cross-reference with the health disparities map, there have been recent hospital closures in that area. And as you can tell, you can go through the provider ratios and you can also see that there are no maternity care provider ratios. And so my general question is, can you spotlight the counties that have the furthest distance to maternity care, as well as the ones that have the highest maternal vulnerability index? And then can you look at whether those counties in the health research shortage areas as well? We already know that some of the areas that are most challenged in receiving maternity care are rural areas, such as Clay County, Macon County, and Pickett County. And I'm trying to understand whether those rural areas are facing other limits to accessing healthcare, such as limited transportation options, fewer healthcare facilities, or shortages of healthcare professionals. Thank you.
Thanks, Gabrielle. So I think what we should do to start is look at this cluster right here that you talked about. So that's Macon, Clay, Pickett counties. So if we're looking at this map, we'll see that um, distance to maternity care, we've grouped it into four categories. Not, like I said earlier, not far, moderately far, far, and very far. These counties are these counties have really, really long distances for, like Gabrielle said, expectant mothers to travel to get to a hospital that has obstetric care ready for them. And in Macon, that's 39.8 miles. If we're looking at Clay County, that's 64 miles. And if we're looking at Pickett County, that's again 64 miles. The maternal vulnerability index in these counties is also really, really high. This is a score from 0 to 100, looking at how, when you take the full picture of what options people who are giving birth have, you are essentially you can weigh how much of a struggle they might face in getting quality maternal care. Macon County is slightly worse with 95.5 vulnerability score, and then Pickett is a little bit better at 62. If we look at health disparities, let's start with rural hospital closures. If you're not familiar, Tennessee is the state with the highest rate of rural hospital closures, and this is a huge issue because a lot of our state is rural. 30% of Tennessee is rural. 30% of Tennessee residents live in rural areas. What this means is folks that live in rural areas are at risk of having their hospital shut down. So if they don't have that many hospitals, which we'll talk about, and then they're getting shut down, and then we see that those areas are already at risk for quality maternal health care, where we see a bunch of compounding variables that are painting a really bleak picture about access. So here, Clay County is one of the rural counties that have had one of its hospitals close. It's also one of the counties that we just saw is ranked the worst in terms of distance to maternity care and has a pretty high maternal vulnerability index. So rural hospital closures are an issue in of themselves, and then maternal health access is a separate issue. And then this map kind of allows you to bring them together in one picture. This cluster right here is of rural counties, and you'll see their life expectancy is on the lower end of the state. And again, we can just layer our understanding of all of these issues together to see, okay, this cluster and essentially rural areas here in Tennessee need our attention. They need our advocacy. And that's really the goal with, I think, using the dashboard. And of course, you can join it, you can quickly hop over and read a story about some clients who have relied on TennCare in some of these areas. So life expectancy is a really interesting data point. You'll see again, Williamson County is just the outlier, has the highest life expectancy in Tennessee. And is that a surprise? They have the highest quality of life, the highest median income. It all ties together. And then as you kind of go through, you can see some of the nearest county is Moore with 78. That's a 3-year difference in life expectancy. And let me just say, a lot can happen in 3 years. That's 3 years of life lived, or not lived in this case. And as you navigate, you can kind of see other counties' um, life expectancies, and then again, getting to the areas with the lowest life expectancy. And one of them has a hospital closure and is a rural area. So I think that's just a helpful way to approach the conversation around maternal health care. And I'm going to turn it now over to another one of my colleagues, Danielle Branch.
Hello, everyone. My name is Danielle Branch. I'm a health policy and advocacy associate here at the Tennessee Justice Center. And in my role, I do a bit of research on a lot of the topics that are listed here on the dashboard, but I primarily do a lot of things as far as engaging and building partnerships with folks and organizations across the state to educate our communities across the state, like I said before. But this year, my team's priority really has been working on and protecting Medicaid because the program is in danger after extreme cuts to the federal budget. And TJC's approach is to do targeted outreach to communities that are most at risk once these federal cuts go into effect. So, Jane, can you talk more about how someone who focuses on working with community partners can use the dashboard to develop an outreach strategy?
Absolutely. So I think this is a great way to tie it all together. Community outreach is following the same mission that we are here at TJC, which it has to be targeted. So one example is with Medicaid defense. Folks might not understand what's at stake with cuts to the Medicaid program at the federal level. So I think one thing that's helpful is to use the health disparities map to show them who's actually on the program. So in I just picked Dixon County. In Dixon County, where there are about 55,000 people living, there are about 11,000 people on the TennCare program. That is a significant portion of the county's population. So that alone is an entryway to a conversation about why they should pay attention to conversations around Medicaid and about TennCare if they haven't already. You can also talk about how a high number of folks in this county are uninsured. So 13% of adults are uninsured in Dixon County, and that comes out to be about 4,000 people. So that's folks' neighbors, those are their friends, those are people they go to church with, people they work with. And I think just using these numbers as a starting point to say, hey, there are a lot of people in your area that actually rely on TennCare. So if we're talking TennCare Medicaid, so if we're talking about federal Medicaid cuts, that impacts you. And that might not be information you could immediately access without dashboard. So I think another way to target outreach is by groups that focus on particular issues. And with that, I definitely want to focus on life expectancy disparities. So let's use Sumner County as a random example. The overall life expectancy in Sumner County is 75.6 years, so almost 76 years. But if you look at different races, there's a disparity there. For white communities, the life expectancy is 75, whereas for Black communities, it's 73. So there's a lower life expectancy for Black communities in Sumner County, and the same is actually true across the state. So if you look at life expectancy in Robertson County, for Black folks, it is 66 years old, and that is almost 6 years less than for white folks. So that is really concerning, and that's information that you can show people where I think it paints a picture again. If this is already the picture, if this is already the state of healthcare and life expectancy, we can't afford to lose access to healthcare because there's just going to be an increase in disparities. So I think that's how I would approach it and kind of move that forward and just kind of say, hey, in your county and in other counties across Tennessee, maybe they live in the place of the rural hospital closure. You can just paint the picture of there's already a disparity in access and in life expectancy, and there's a high reliance on these programs that are going to be cut. So that's what I would say.
Okay, thank you. I have one more question. So a large part of what we do here at TJC as well involves lobbying. And with lobbying, we're working on passing bills, which means making sure that our legislators and their staffers understand how positively impactful a lot of the bills that we're pushing will be on their constituents. And the more specific we can be, the better. So let's say I'm having a meeting with a legislator coming up, or I can have a chance to present in front of a legislative committee about anti-hunger. How can I use the dashboard to prepare for that meeting?
Yeah, I think that's the ideal scenario. So community outreach is important, targeted community outreach is important. But when we talk about systemic changes, we are talking about, the decision makers, the lawmakers. And so if you have an opportunity to attend a town hall or a committee meeting or speak to a legislator directly, I would recommend using the dashboard to pull data for their particular county. If you were someone that might have struggled to do that, you don't have to struggle anymore because it's all laid out here for you. So if you know the areas that the counties that a senator represents or the cluster of counties that are representative might represent, you can actually use the dashboard to compile specific information about what that individual's constituents are facing. So I would definitely recommend getting a list of the counties that legislator represents and where their constituents are based, and then just localizing your data collection and pulling that and bringing it to paint a picture. And I think in a lot of cases, it's good to be specific and direct, but what's helpful about the dashboard is you can actually say, I'm coming to you about this issue to do with perhaps nutrition. So we can talk about SNAP access, the number of grocery stores, access to grocery stores, access to healthy foods. But hey, this is actually connected to housing as well. So if you have an opportunity to bring multiple issues together, you don't have to start from scratch with each one. They're all here for you, and you can just kind of pair them together. So I think when it comes to legislators, you can just literally, for the counties that are relevant, you can just copy this information and then make them a kind of a going away sheet, a leave behind, one pager where you're saying, hey, from Maury County and this other county that you represent, these are the numbers, these are the disparities, and that is why we want you to act. So I think that's a helpful way to approach that. Well, that's it for the questions from our panelists, and that's it for my official demonstration. I'm going to have the dashboard open, but I wanted to turn over to our Q&A and have and kind of work through the questions that you all have been sending. Let me navigate. Okay, here we go. So we have a couple questions already. Thanks, guys. And we hope that more come in as we kind of go through the conversation. And if there are any in the chat, Reed will let me know. So we have someone asking about, again, in the context of the Medicaid cuts, asking about whether there's any way to track the real life impact on individuals here in Tennessee. For example, how many individuals are at risk of dying or getting sicker if they lack access to healthcare. We're not able to put that out just yet. So the structure of the federal cuts to Medicaid are that over the next 10 years, about $1 billion is going to come out of our state's healthcare budget on an annual basis. So it's really hard to predict what that change will look like. And because of that, it's not really possible to incorporate that at a county level on the dashboard. But there are estimates that upwards of 200,000 people in Tennessee will lose health care. But until we have that on a county by county basis, that's not something we will put on the dashboard. But what is helpful is you can actually use the dashboard to look at the insurance rate in your county. So the uninsured adults are 27,000, and that's about 12% of adults there. I mean, we don't want that number to go to increase. So we can already say that the baseline point is concerning. So we don't want to worsen the situation. So I think we just pivot from an exact number of how many people will lose healthcare or will be impacted and focus on the current problem and how we don't want it to get worse. So that's my recommendation. Moving on, we have a question about how often the data is updated. So we will be updating the dashboard on an annual basis. Every fall is our goal is to release a new version of the dashboard every fall. And a lot of this data is based off of the census, which also releases annually. So we don't at this point have a reason to update the data more frequently than once a year. So I hope that's helpful to folks. A lot of this is hot off the presses information. And we have a couple folks asking about how often this will be updated. Yes, we have someone asking about the methodology and the list of the data sources. Absolutely. I am a huge fan of being transparent about methodology. I'm really excited to post that right here where there's a source section of the dashboard. Shortly, you'll see a link there to our TJC guide to the data where we list not only our sources, but how we use them and how we pair them together for each map. So our hope is that you all, if you're so inclined, if you're a researcher or you just want to dig into something you thought was interesting, you can go right to the primary source and learn more yourself. So yes, we will be releasing that and it will be part of the dashboard and of this page. We've got another question, which is how are stories being collected and by whom? This is a great question. So our we have a story collection process built into our casework here at TJC. So when we work with clients and we help them resolve their issues, we always ask them, would you like your story to be part of the TJC website? And if I may, actually, I'm going to just show you all, we have a complete stories page that has some of the stories I shared on the dashboard and more. So folks can actually reach out to us, call us, fill out our story collection form, email TJC, and we build their stories into our story bank. And they all live here for forever and ever. And you can catch up on some of the amazing work that we've done at TJC and some of the incredible people that we've had the privilege of working with. So our story collection function is independent of the dashboard. We're just trying to bring it in. And again, our caseworkers collect stories as well as other folks who are really passionate about ethically and doing justice to our clients' stories. We have stories about TennCare, Medicaid, children's health, whatever you might be curious about. So thank you for highlighting that. And I'll also demonstrate actually, if you're on the dashboard and you click on the story, boom, takes you straight to the full story and you can read it and just again get that real life context. So thanks for highlighting stories. We have some more questions coming in. Someone's asking, when looking at distance to hospitals, were hospitals that are in other states lines included in the calculation, or just hospitals within Tennessee? The methodology that I had reviewed from March of Dimes was just looking at in-state hospitals, but there obviously is a phenomena of border counties obviously going to the neighboring state as needed. But this is just looking at the average distance that they would travel to get to a hospital in Tennessee. So I think that's a really good point from this attendee, because if you're in a county, for example, Lake, Dyer, Lauderdale, that might have less of a access to a hospital, you might have better luck going west than going towards Gibson, for example, where there's actually no the most recently there's been a hospital closure. So that's a good point. Someone's asking on the demographic map if we have age info. So on the demographics, actually the main indicator is rurality. So again, just like making sure folks know right off the bat which Tennessee counties are 100% rural and which ones are basically 0% rural. So we don't highlight age, we really just focus on population, rural residents, and then who's on several of these programs that we work on. And then of course, racial diversity. But I want to say on that note, we do have a feedback, an email here for feedback. We want to make this as useful as possible. So if I can take that message to mean that age breakdown would be helpful, that's something we included last year that we didn't include this year, but we're happy to kind of play around with this and include information that an age breakdown, if that would be informative to you all. Someone is asking, what is the best way to cite the data dashboard when used in reports or as supporting information for funding proposals? That's a great question. I'm not super picky, so we can kind of come up with a standardized format, but we usually defer to, APA or Chicago style, and you can just link to the TJC website and the health equity page and credit the organization Tennessee Justice Center rather than any individual. That is sufficient for us, but we'll update this page if that changes. But I think you can kind of go forward with the standard web page and date accessed. But thank you for asking. We would love to see this go forth. We have someone asking, will there be more chronic illnesses included in the dashboard too? As of right now, we don't have any plans to, but if we can collect quality data on other chronic illnesses, we'd be happy to include them. A lot of these points that you see on the data dashboard have taken quite a bit of research to get to the bottom of them, to clean the data, and to make it work with all the other information we have. So if folks feel that there's something that is not on here that should be on here, we are happy to include that and obviously do our due diligence and include that. But as of right now, there aren't any specific chronic illnesses that we would be able to update at the county level, maybe at the state level, which we can share too. And then one more question before we kind of start closing out. We have someone asking for a little bit more of a deep dive into the behavioral health conversation, the behavioral health map. And I am happy to dig into that. I don't think I spent enough time on it. So behavioral health, sorry, I'm trying to. So behavioral health has primarily the mental well-being index. So this is just, again, it's like the quality of life rank. It takes a variety of factors like access to mental health care and walkable areas and, education and all these different factors to rank each county by its mental well-being. Again, this point one being kind of the worst well-being, and then kind of going up. So what we focused on for the data points are drug overdoses on the substance use side. So fatal drug overdose rates for that county, as well as non-fatal drug overdose rates, just because that's such a pressing issue in the health justice field right now. One thing I really want to highlight is the mental health care provider ratio. So provider ratios are a way to say for every one healthcare professional that lives in that county, how many people are relying on that person. For mental health in Davidson County, there are 230 people relying on every one mental health care provider. That might seem a little whoa to you, but let me pull up some other counties so you can see. In Hickman County, there are 1,519 folks relying on every one mental health care provider. We were talking about Fayette County, there are 3,000 individuals relying on every one mental health care provider. So this is just a way to kind of look at the level of need for behavioral health care as a whole. There are 10 mental health care providers according to Tennessee's own data about the behavioral health access. And there is one youth mental health facility in this county and one behavioral health safety net. So a safety net is a hospital that is a health center that operates slightly different from a hospital. So anybody can go there without insurance. And that's really important for a lot of people because, as you saw, there are tens of thousands of people who are uninsured in our state. So, or probably hundreds of thousands, but in each county, there can be tens of thousands that are uninsured. So that's kind of what we covered. Just what is the burden on the mental health care system? And then what is the picture of substance use? We also covered suicide rate because that is a very credibly reported data point. And so we felt it was important to include as part of that picture of like the crisis of that county and what attention needs to be paid. And just on that note, I'm just gonna take 1 second to show you all more provider information on the health disparities map. So if you're curious about provider ratios, we offered the same thing for primary care, for obstetric care, for pediatric care, and for dental care. So you can see how many people are relying on all of these different providers and how many safety nets there are, which is like a free healthcare. You can see what exists in different counties. So yeah, those were some great questions. Thank you everyone for chiming in. I'm going to switch just really quickly back to my slides just to move us through towards the end of the conversation. I hope this was helpful for you all. When you receive the recording and the slides, you'll actually see the questions that folks ask, so you can work on maybe finding answers to questions, these questions or similar questions yourself as you play around with the dashboard. I wanted to make sure that that was available for folks. But we're really going to close out with talking about data and advocacy relationships. We will be sharing this dashboard with you all on our website, obviously, but we are really excited to present this to you all. So I wanted to let you guys know that in the last year since the dashboard launched, we have actually partnered with Belmont University in creating a data and advocacy course where students create their own mini dashboards and explore the same questions we're talking about today. If their focus is overdose rates or access to nutrition and food insecurity, I work with them to pull the data, find the data, pull the data, and build their own dashboard and answer their own mini research questions as kind of a semester project. It's been really fun. It's been so great seeing these students understand why this work matters so much and why I'm so passionate about it. And they build a little bit of passion as well. And so that's been really exciting. And that's been going on a year now, and we're starting back up this fall. I've presented to students at Vanderbilt University as well about the dashboard, and it's been kind of a vehicle to bring them into TJC and to work with me, work with us on these really pressing issues this day and age. And the question mark represents you potentially. So if you work in an organization that is interested, maybe you're here on behalf of your organization and you think folks would want a deep dive into maybe one data point you saw, or an overview of the dashboard as a whole, we are so excited to bring this to you, in addition to encouraging you to use it on our website. So we want to build relationships that merge data and advocacy because we think that we've taken the time to get this information. It's up to you all to use it. And I think that that can be taught really quickly and taught really well. And I don't want anyone to be intimidated by data or by numbers. We've done our best to make it as accessible as possible. And we want you all to take advantage of that. So reach out to me, reach out to us at TJC if you would like this dashboard to be presented to your organization or a group that you know, or if you just want to talk through some of the information that's on there so that we can kind of figure out a way to make it the most useful, as useful as possible to you. I have one question that just came in. I'm going to just answer quickly. So someone's asking, will this wonderful dashboard, thank you, will this wonderful dashboard be shared with representatives either at the state or federal level? They paint a picture of thanks to them, everything is wonderful and lots of fraud, which is not true. So someone actually suggested presenting the dashboard to some committees and to some groups who might include legislators. We are open to doing that. We have our robust policy team that can organize things like that. But yeah, that's definitely something we're exploring, and we're interested in pushing this forward to decision makers, especially because we want them to see that where there are disparities, we are paying attention and we want to push for something better. So thank you for highlighting that. We do want to make this kind of more informative, or more of an informative source for our legislators. So yeah, thank you folks for such great questions. Everyone's so engaged. So we're right at time, which is perfect because I want to say thank you and also remind you all, you'll be getting my direct contact information as well as our communications manager, Reed, who's behind the scenes tapping away. So she's the one that's been giving you all the critical information. You can reach out to us about this, about other things, about all of TJC's work, and we are always happy to answer and help you out. This is a passion project for us, and we've really seen a lot of progress in its first year, and we're so excited to see what happens in the second year. So thank you to all of you for joining, for meaningfully engaging throughout this conversation. And I just want to say a special thank you again to Gabrielle and Abigail, who spent the summer digging through so many Excel sheets to get to what you see today. And it looks beautiful and it's easy to use. It's so perfect and it's what I always wanted. So gratitude to them. And again, hopefully you all can make use of all of our great work. And of course, to Danielle for joining and talking about her community outreach and lobbying work. So I've talked a lot. I'm going to stop right there. And again, say thank you to everyone for joining, giving us your hour this afternoon. And I'm going to stay on for a couple minutes, but for just a minute before I end the call. But please, please reach out to us at TJC if you want to talk more about data and advocacy. Yeah, thanks, y'all.